Yay!
Hello.
Hello. How are you?
Can you hear us?
Yes, I can hear you. And if everyone else can hear them, please say so. But I
Yes,
can hear
let
you
us
guys.
know. Give us a shout if the audio or if we're standing too far away because we're sharing one iPad among the two of us. Wow, amongst the three of us with our little kitty in the background.
Yeah, no, you guys sound great. Someone says yes, there is sound. So that's are we ready to go? So welcome, guys. Welcome to I think it's our
Thank
fourth
you.
lockdown live. I'm so happy to see you both. I
Yes,
miss
thank
both
you.
of you very, very, very
We
much, and
do
it's so
miss
nice
you
to like
too.
see you guys together, even if it's on a screen. And just an introduction on the on the two of you. You are a very well respected and very experienced couple in
Aww.
our world of aesthetic medicine. And Dr. Zeenit Sheik, you've got 4 years of experience in psychiatry, as well as
Yes, I
many years
have.
of experience in aesthetic medicine. And how we met is we've all done the advanced aesthetic diploma together, and you've married in your practice. You guys co-founded the Aesthetic Doctors,
Yes.
Yes.
psychiatry, science, art, beauty, all in one beautiful aesthetic
Absolutely,
practice.
yeah.
And you
And
also,
and and she's married to
yes,
me, so she's got like a
which is very
long-standing
cool. So
history of
that's
dealing with
also an
psychiatric issues,
accolade.
you know. So,
Not at all.
And Dr. Shahien Dollie as well. So very much involved in the Aesthetic Medicine Society of South Africa. You're an executive member, also scientific committee of both our congresses, AMSA and Cosmetica. Both of you are international speakers and have had many articles in print and
oh,
digital media. Yeah,
that's
and
so sweet
so,
to
so,
say. I But we
so
all we
please,
all we all we all learn from each other,
Yes.
and
yes,
we're all teachers, but we're all students too. So it doesn't matter how experienced you are, there's always something new to learn,
Yes,
and you can learn something from
always,
everyone.
and learning and sharing
always,
Yeah.
ideas,
always,
that's the most important
yes.
thing. Yeah.
And I think that's why, I mean, we used to go to a lot of congresses together nationally and
Yeah.
internationally. And, we had some really good times. I actually miss that very much. And I know we're
Mm.
learning a lot, via webinars and on all the lives that we are watching. But I miss those days, actually. I do miss those days. I
Mm.
know they'll come again. But we had like a really
Definitely.
good time in business. I mean, we
I
had
think your
supper
your
in
your
the ISO
your
party.
your
Yeah,
boundaries or your viewpoint on different
yeah,
things gets expanded by
Mm.
travel when you start interacting with
yes,
different cultures, different languages, different
yeah,
foods, and in a way, within South Africa, we are privileged because we are a multicultural society to begin with,
yes,
but
Mm.
we really broaden those boundaries with travel. And what better
yeah,
person to do it with
Yes.
than close friends?
yeah.
Yeah, we're privileged to have the group. We're privileged to have a
And
support
we do
structure.
have,
Yeah, with our
yes,
friends
yeah.
and colleagues, and great to have people to travel with and learn together, share ideas, and it just makes
And
it
it'll
so
happen
much.
again. It will definitely
Oh, yes,
Yes,
happen
yes,
again. Yes,
yes.
yeah,
The
yeah.
future
we
is bright.
we look
Definitely,
forward to
this is gonna happen
that.
again. Yeah, I'm certainly looking forward to it.
Yeah.
In
Awesome,
fact,
awesome.
we were planning to be in
Yes.
Monaco for Aesthetic Medicine
Yes,
World Congress, and we were even gonna do a trip to Italy
Italy.
thereafter. So thank goodness
yes,
things happened when they did. Otherwise, we would have been
Yes.
yeah.
stuck in it.
Yes, no,
Yeah.
yes, deep in Italy. So, guys, you have a special, we've got so many topics to cover today. Actually, so many interesting things to discuss that's of special interest. And one of the things
Mm.
you wrote an article on was skin lightening. So, skin lightening and the
Mm.
desire to lighten your skin is widespread, across the world, Asia, especially India, African countries, and South Africa isn't spared. Where does this
Yeah,
come
yeah.
from? Where does
So,
this desire originate from?
the origins of the desire, or the want, or the need. for skin whitening, not just lightening, but whitening
Whitening,
itself,
yeah.
is so deeply ingrained within cultures. And there's lots of reasons, from white supremacy to, and we cannot exclude the effect of colonial influences within our country as in its own. But even if we look at pre-colonial times within
Yes.
Indian caste systems, or even in the
Yeah.
Far East, you know, the idea of colorism or the preference for specific skin tones or lighter skin tones is already present. And the
Yes.
real thing about it is that it has a real effect on society today. It's not just about, I want the lightest skin possible as a personal right, but it also has an effect on the way that society treats you as a whole. Within a lot of studies within the
Yes.
US, we have a look at the penal system. You get two black women convicted of the same crime, but the darker
Yeah.
skinned one would serve a longer sentence.
Wow.
And it's incredible to think about that. Like, at the same time, the education system, it shows that if you're in the higher echelons of business, if you have a lighter skin tone, you're more likely to be promoted or get that job compared to
Wow.
the education that you have. So on the
And
one
even
hand,
today, Shahien, so
yeah,
that's happening today even? Okay. Yeah.
yeah, the origins of it have come from, you know, past slavery, these sorts of things, even like royalty back in the day. The whitest white was deemed or revered, and if you were rich enough, you'd never have to see the sun. Whereas the
I
poorer
think,
who were toiling out on the farms back there, they were in a permanent state of sunburn. So there's these sorts of feelings and these sorts of ideas that have persevered throughout, and they present today. And
they do. They
certainly
so
South
do.
Africa is not spared. Like you
Yes.
said, Africa makes one of the largest users of skin lightening home care kind of treatments. You
Yeah,
know,
we do see a lot
And
of that. Yeah, a lot of
yes,
patients
and damage
presenting
from
for
that.
damage,
Yes.
especially. Yes. Yeah.
You
and
know,
that's
I
the thing.
can tell, oh, sorry.
Yeah, in the pursuit of this, people do dangerous stuff,
Yeah.
you know,
Yeah,
and
so,
and
yeah.
and that's the problem.
You know, was it you guys that I think it was you that said someone even approached you about their baby to actually,
Yeah.
yes, or, you know,
Yes.
yes, to lighten their baby. That was a while ago. And often you get patients that come in and you can see the damage to their face and neck. Everything else is fine, but they've used the screen, and there was no problem before. There was no hyperpigmentation or anything that they needed to use a particular cream for, and then they use you know, a cream, go on a holiday, and then permanent damage. Permanent damage is done, which is very, very sad. Like treatment-wise, what can you offer patients? You know, I'm saying this permanent damage, so it'll never get back to what it was. But what sort of things can patients do to rectify some of the damage that's been done by bleaching and skin lightening? And what are some of the things actually that you have seen in practice? What kind of damage have you seen?
Okay, so we have seen very severe forms because the lightening creams are very accessible through the borders here. You know, in Nelspruit, we surrounded
Yes.
by Swaziland, Mozambique. So a lot of patients have access to these creams and they get referred by their friends. So they don't know if they need it or not, if it's good for them, what kind of damage it will do.
Yeah.
And then they start using these creams because they see fast results. And people don't realize the difference between hyperpigmentation and just trying to lighten normal skin. So they try to
Yes.
lighten their skin that is normal, and that causes the damage. So you know, we definitely would not start treating the patient with any forms of cream or chemical peeling, because that skin is angry. So you cannot
Yes.
really touch that skin topically. And we would have to look at things more internal support type of things, you know, and glutathione and supplements and definitely sunscreen. Sunscreen.
Yes, yes, yes. The sunscreen, yes.
Yes, so
But
those are the
so you just mentioned glutathione, and there's different speakers and over different even lives and articles and views in our aesthetic community on glutathione. It's a very controversial topic,
It is a
actually.
controversial
Very
topic.
controversial topic. Yes.
I think the biggest problem with well, most of these sorts of agents is
Yes.
the amount of data and safety data that comes behind it. Firstly,
Yeah.
something has to be safe, then it needs to be effective. That's the differentiating factor between using, I don't know, cassava roots or some sort of natural kind of agent on the outside
Yes.
versus something that is a pure medication. It's the amount of steps that goes into ensuring that what you're delivering is actually going to do what you think it's going to do. And I think glutathione is one of those where there aren't enough studies out there, the cumulative data to completely say, you know what, this is the dose that you're going to do for that. This is the dose that you're going to do for that. At the same time, we also don't have easy access to testing facilities to see how much glutathione is in your body at any specific time. How much is in the serum, how much intracellular. It's really difficult to measure these things. Whereas if we take something like iron, ferrous sulfate, you measure the iron, you can do iron studies, you can see. Whereas glutathione is not as easy, nor is it as widespread. But yes, you're absolutely right. It's controversial, and lots of people are constantly arguing about these things.
Like with anything, I suppose. And if someone comes to me, say, someone wants to consult, and then they say, I would like my skin, that very often people are like, I want it 2 shades lighter. What sort of answer do you give them? How do you answer these sort of patients? What do you say? I know what I say, in a very diplomatic way, but what do you say? Yeah.
The first thing that I really like to get my patient to understand is that your skin color is your skin color is your skin color. Genetics is what essentially says this is what your color is. You got to look at your mom and your dad. That's where you inherited. That's your skin color. Then things happen to the melanocytes and things happen in life. Within the skin, deep down, there's that melanocyte, makes those little melanosomes of melanin in it, and that is the actual pigment. If you irritate those melanocytes, if they get angry, they're going to make more. You can burn them with the sun, you can burn them with fire, you can do whatever you want, but if your genetics codes for more pigment, then it doesn't matter what you do. If you irritate those melanocytes, it's gonna get angry. Angry melanocytes, we can deal with. That's okay. But if your melanocytes are perfectly calm and it makes your skin color for what your skin color is, and you just want to be white for the sake of being lighter, this is not something that I would advise. That's the first thing I try to get my patients to understand. And it's also worth looking at an interesting hypothesis, like, why do we have pigment? Why do we have the skin color we have the skin color? And like everyone jumps to, okay, it protects you from the sun so you don't get skin cancer.
Yes.
But there's another interesting hypothesis that is fairly well followed, which goes on vitamin D and folate. And we need a certain amount of sun exposure to activate or produce enough vitamin D, and vitamin D is closely related to metabolism of calcium and essentially bone health.
And immunity now, which is a talking point.
And immunity, not just immunity, but also vascular flow, perivascular flow. And on the other hand, you got folate, which is quite important also for reproductive means in terms of pregnancies, neurotube defects, these sorts of things can happen when there's lower levels of folate, as well as just fertility, even from sperm mobility. So evolutionary speaking, we need some sort of balance, because ultraviolet radiation from the sun essentially breaks down, for lack of a better, simplistically speaking, decreases the amount of folate, but increases your vitamin D. So if you are in the middle of the equator and you have crazy amounts of radiation, you're probably going to zap all your folate away, and evolutionarily speaking, this is not great. And if you're in the furthest north of north and you have the lowest amount of radiation, you're probably not going to get enough vitamin D. So if you look at a world map of, I don't know, 100 years ago, before we were flying around everywhere, you can see that closer to the equator in the hotter areas, this is where the darker skin tones come from.
Yes.
There's only one hypothesis, but it is one of the most largely followed hypotheses. And I think there's something to be celebrated in our variation of skin color and our variation of cultures. And this is also another point that I really like to try to get my patients to see, that, you know, there's a certain beauty in having dark skin that is flawless in its own right.
I know, you know, I just recently, just before we went on, there was another post on the page about celebrating and like beautiful, darker skinned, models and actresses. And, you know, I think we're going to get to, social media and media at the end of the talk. But, I think it's important that, you know, that sort of reassurance is also, in the media and in social media, because growing up, you know, well, okay, I grew up in the suburbs, so we were very suburban, but, you know, I mean, obviously still exposed to these Bollywood movies and that sort of thing. And let me tell you, like, and everyone in these movies looked really, it was normal, that because in your head you think, oh, is that how people are supposed to look? Is that how it's supposed to look? And then where I grew up, there weren't that many Indian people, and in our community, we Gujarati community. In my head, I thought all of us have to look a certain way and be a certain color and whatever else. So, you know, and because I didn't have exposure to that many other people, quite a culture shock when I came to university and at med school. Like, there were so many different kinds of people, and, you know, because, you know, we were in the suburbs, and literally I was the other Indian person there in the school for a long time. So yes, I got my idea of what you're supposed to maybe look like from the media, and, you know, it's not, it wasn't right. It wasn't the right idea, but I think it's changing. I think it's hopefully it's changing in Southeast Asia. I know it's changing in India, and I hope it's changing here in South Africa as well. Yeah.
I think, you know, it is quite sad. Like, if you look way back in 47, Clark and Clark took their first original white doll, black doll test. And they've just basically took a whole bunch of kiddies, of like sort of primary school children, and they basically gave them two dolls, where one was a darker skinned doll and one was a lighter skinned doll. Just the same doll, just like painted differently. And they would ask these kids, who's the good doll? Who's the naughty doll?
Oh, yes.
And, you know, what's the pretty doll? And I asked them questions like, why? And then, because these were kids of different colors, they were asked at the end, which doll are you? And then the kids would get stuck. The darker skinned kids would get stuck, because being black, they're intimated more often than not that the naughty or the negative aspects were attributed to the black doll. I mean, in fact, it was so heartbreaking that the two researchers had to stop their studies, because they were like getting personally, like, you know, affronted by this, and it took them another year or two to complete the study. And their study was instrumental in the abolishment of separation of schools in the US in the 50s. So, you know, it's interesting to see that not that long ago, 4 or 5 years ago, there was a remake of this study, which is just a few years ago. And like a lot of opinions within these kids haven't actually changed. So it's
Wow.
The
almost
psychology behind it
ingrained.
is so interesting.
Yeah.
You know, the whole psychology behind and what you're influenced by,
Mm.
as you mentioned, your socioeconomic status, everything is dependent on that. A lot of people look at that and they want to be lighter because, as we've mentioned, they see it as a form of being better
Like a status.
socioeconomic.
Yeah.
Status, yeah. So,
Yes.
you know, we need to, we do get behind when we interview a patient, when we do a consultation,
Mm.
we talk about that and find out why do
Yes.
they feel the need to be lighter. And once we
Yes.
find out what that means to them, we can then go into how to treat them effectively, you know, and
Yes.
we do not condone skin lightening in its,
Yes.
you know, in lightening the skin, but just to get that healthy skin, that even-toned, radiant skin, that healthy, and bring them
Yes.
back to their original color. That is what we, you know, what we try to put through to them.
Yes.
And
Because
more
I think,
often than
like
not,
saying,
patients
yeah,
actually
yeah.
accept it. More
No,
often
they
than not,
do.
patients actually, they get better once they get better
Yeah.
insight into it. And I think it's
Yeah.
incumbent on us as doctors or as medical professionals. We shouldn't be supporting, you know, a one
Yeah.
color is the ideal either.
I was
You
just
know,
about to
we should be
say
part
that.
of the
Like we got,
solution. You know,
yes.
it's deeply ingrained within culture, within all sorts of cultures, but that doesn't mean that we can't try to change things for the better. And it needs to be
No, true.
intentionally
You're
so.
right. That's what I was about to say, that we have an ethical responsibility
We have
to
that. Yeah.
educate and treat our patients accordingly and properly and ethically. So yeah, no, guys, that's pretty, you know. So it's a very controversial topic. It's a very yeah, we could speak about it the whole day.
We could
But
go on forever.
we'd be pleased to get any questions on it as well. But I know secretly a lot of people still, it's very deeply ingrained. It's going to take a lot of work, even from us, in terms of patients, to kind of get people to feel more confident in their own skin. Yeah.
Yeah.
And then
What's really funny though is a few years back, we were at a wedding in Latvia, and these bridesmaids and these girls, where they were incredibly white, like pale, where you can see sort of through the skin, translucent. And before the wedding, they were all trying to catch a tan, you know. So it's like nobody's happy with their skin color. Like white people want to be darker, dark people want to be lighter.
It's true. You know, I'll never forget, when I was in primary school, we went on these camps, you know, these leadership camps or whatever they were. And then I remember someone like grabbed me in front of the mirror, and I thought, what's going to happen now? And she's like, oh, I'm not good enough yet. You know, just like putting her arm against my arm. And I thought, okay, you know, yeah, you're right. So... And then, you know, guys, the last time we saw each other in person was at, I think it's the Regenera launch, which we're going to also talk about a little bit now. And that was great. So, you know, I still reminisce about all the times we've seen each other in person. And, you know, we always go for a little course, and then we make time to have a bit of supper, dinner, coffee, or whatever afterwards. And one of the memories I have of when we were together in Eastern Europe, in Georgia. So guys, like our listeners, whenever you can get to a place called Georgia, it's a weird way to get there. So when you can travel that way, it's a really nice country to visit. And we were very surprised. Yeah. And then all of us, finished our talk at the Congress on the first day. So, you know, you get a bit of breathing space. You don't have to worry too much about the next day.
Around, you get to explore.
Yeah, and then we had those drinks and supper at the hotel, and then we were so tired, but we didn't want to stop talking. We just like couldn't, and we actually, to save energy, we were all like holding one eye like this.
But we still wanted to chat, and we just
and then eventually we gave in and said, you know what, let's go to sleep. It's still tomorrow. So sorry, getting back to Regenera. So
I think that was one of the really nice things about travel, is that we also get to like walk.
and experience the place.
You know,
Yes.
like when last did you like walk around your
Yes.
neighborhood? Like, you know, like we just don't do it. We drive.
Yeah, in South
go,
Africa, we're
do your
very
thing,
spoiled.
and
We just
that's
drive
very
around.
different. Yeah. So the one nice thing about traveling is that it also forces you to exercise and use public transport, and it's a great way to explore things.
Yeah, that's the only reason we travel, just to get some exercise.
10,000 steps.
You gotta get those steps in.
Yeah. So, going into regenerative medicine now, so we all love it. We all do a couple of different things in our practices. I am a big proponent of PRF, and I know the patients that have it done know, leukocyte rich PRF, and I know you guys do a lot of work with PRP. We're going to talk about all the cool stuff you're doing with that, and also SVF. And now, after that launch, you guys did get one of those units for the peri-sites, and
can't wait for
but it's in Italy now, so that's going to be a bit of a wait. But tell us what's happening PRP wise, and if you can go through a bit of, well, we'll get to the peri-site. So PRP, what are you doing? What are you seeing in the practice? Like, are you getting good results? Yeah, tell us a bit about your.
I think the field of regenerative medicine as a whole is expanding and unfolding. And I think in the beginning, there were many who were sort of still holding back and kind of sort of looking down on PRP because of its variation and its variability. When we use PRP, we obviously are harvesting and concentrating the platelets from the patient's own blood, and platelets vary depending on your inflammatory state. Oh yeah, exactly. You thought it was a doll, didn't you? And she's listening in. I think she agrees. PRP is the way to go.
Okay, sorry about that. Yes,
and the one thing that was standing a lot of people's way was that a lot of the studies were very different across how it's being harvested, how much blood is drawn, how many platelets, what is the concentration of platelets. And it's very difficult to compare apples with apples when everyone's methodology is different. However, the total mass of the data that's available now is starting to show that, yes, definitely, there are improvements in fine skin wrinkles, hair rejuvenation. There is enough evidence for us to say, no, this is a conclusively scientific procedure that is not just, mumbo kind of, casting a spell kind of a thing. So we know that it's got a rich history of what it's been used for, all sorts of things back from, animal based with race horses and their knees and things, all the way to, and you can speak a lot about it, like its use in dentistry, which was also really big before it actually came to the forth in skin and dermal use.
So in dentistry, I use this a lot, is the PRF, so platelet-rich fibrin, but liquid, like injectable platelet-rich fibrin. But you also get it clots as well. So it's got leukocytes, which are white blood cells, mesenchymal stem cells. And initially, it was his name is Shahien, a doctor who had a pain clinic, and that's where he thought, let me use these blood clots for foot ulcers and all of that. And he saw results, and I must say, and the same with PRP, you see good results with scarring, and there's a very popular doctor in all places, Paris, who does prolotherapy for back pain, Dr. Bell. He is always booked out. So it's got so many uses, and for me, I found that with also acne scarring, and also acne, active acne, because it's got an antibacterial
Definitely.
sort of
Yes.
component. It works very well. I was going to say something else. Now I can't. And combination treatments, combination tear troughs
Yes.
mixing it with your
Yes,
excellent stuff.
definitely.
So I know, because whenever you guys, I always watch your stories, obviously because we're friends, and you always, like, literally every single day you're doing some sort of regenerative procedure, some sort of PRP on your
Yeah,
patients.
yeah,
So
it's such a
yeah,
popular treatment, and it's one of our most prescribed and most requested treatment. And we just love the results. Patients love it, and you know, moving towards regenerative medicine, it's something that
mm.
anybody can benefit from. So whether they
And very
do it,
safe,
yeah, very safe.
very
That is
safe.
the one
Yeah,
big thing. Like,
Yes,
yeah.
it's autologous, it's from your
yes,
own self. So,
yeah.
you
No
know,
other
you
Mm.
know,
chemicals for people who are concerned about that. So,
a
yeah,
lot of the
it's
patients who
Yeah.
have the sort of a naturalist type of
Yes,
outlook.
approach or
Mm.
personality,
yes,
like, oh no, I don't want that. That's toxins. That's, things.
yes.
But
The snake poison.
when we start talking about PRPs, we're trying, like, we're using your body's ability to heal itself. That's all it
Yeah.
is. Even,
Mm.
I mean, I've got a sort of rich background of orthopedics, and even
Yes.
when you break your leg, and we don't, like, fix the bones. We kind of just put the bones there together, and then we'll put a plate or a nail, or we'll
Mm.
put a cast to hold it. Your body grows it together. It's a healing
Yes.
response that's inherent within your genetics that actually does it. So what we do with PRP is we're hijacking that capacity. We're using the body's natural ability to
To heal.
regenerate. Now, we're not like salamanders where you can cut an arm off and grow an
And
entire
grow.
arm and bone and claw and everything through. But,
Yes.
maybe one day in the future. But we try to push the boundaries with what can we do with regenerative medicine? How?
Yes, the parasites now. So this cool thing
Hmm.
that we're waiting for now, once
Yes.
Italy is up
Cannot
and
wait for it to come.
running. Yeah, so yes, so everyone knows about PRP. So if you can maybe
Yeah.
go
So,
through
yeah.
these amazing parasites, these amazing cells, and it's actually an easy procedure. So yeah, if you know
Yeah.
what you're going to use it for, and how, like, what's it going to be in the future with like different options, in terms of regenerative medicine.
So one of the things that is really attractive about parasites is that it has ability to transform into mesenchymal stem cells.
Yes.
Mesenchymal stem cells can differentiate into all sorts of things: cartilage, bone, marrow, connective tissue, and the dermis in itself. And
Yes.
this is where the amazing thing comes. Now, mesenchymal stem cells on their own can't really replenish themselves very well, but parasites can become that. And then this is the brilliance of it. So the procedure that we were together on is where we use a small little fine little biopsy of skin, and
Mhm.
from that dermis we can then
So
extract
yeah.
the parasites,
Yes.
turn it into a solution from behind the ear, and then we can then introduce this into the area. And the
Mhm.
beauty of parasites is that it can support and turn into the mesenchymal stem cells, which then can then
Mm.
support the end tissue. Now, the specific company, and we're not, like, talking about brands here, but the specific company, specific
I
machine,
studied
and
that.
specific process essentially
Yeah.
is they licensed it specifically for alopecia
Yes.
of sort of hormonal forms of androgenic alopecia.
Mm.
I do think that parasites have a much wider um,
Yes.
capacity,
Mm.
and I think the indications are certainly going to expand. But the reasons why they try to limit it is because they didn't want to fall into the same trap that PRP had in the early days, where
Mm.
everyone
Yes.
was just doing everything, and you couldn't compare apples with apples to get finite studies to say, if you do it this way, you get this result. If you do it that way, you get that result. So I think, in terms of a regenerative step, I think, as Catherine Davies said, parasites are
Yes.
the new darling of regenerative medicine.
Oh
And I
yes.
think it's
Yes.
going to be a focus where,
Mm.
in the ensuing months to come, we're going to see more specific areas of where it's really going to excel.
Oh, it's quite
Yes.
exciting what can be
Yeah.
done.
And
Yeah,
it's
looking forward to
yeah.
it.
And it's an easy procedure, Hazy. So
Yeah,
Yeah.
yeah.
it's like just a couple of 3 or 4 punches behind the ear. This is for what you guys are going to be doing soon. So treating male pattern baldness, so androgenic alopecia. And what Shahien was saying now is that it can do other things. Yes, like we're talking about acne scarring and stretch marks and all of those things. But for safety and for data and for good end results, a standardized approach has been taken just to, focus now on hair loss, like male pattern hair loss and treatment of male pattern hair loss.
But I certainly think that skin quality, stretch marks, these sorts of things, we can also look at. I think the future is bright. I think, yes, there is what it's specifically licensed for. And this is one question that somehow people often ask is like, oh, is this procedure or medicine FDA approved for that? And it's a little strange for South Africans South African doctors to be also, I think the FDA is an American organization. It has very little to do. Obviously, we want whatever machine or medical device to be used. By no means are we advocating that if you or another doctor in another country, should you disobey your own government's regulations. Within South Africa, what's it, the SAPRA, or what was the Medical Control Council previously, obviously they are the ones who approve all medical devices within South Africa, and I would advocate that everyone should listen to them and do things the way it's meant to be done. Having said that, many medications are used for things that is not what it was originally designed for. The side effects were actually found to be better than its intended effects. And we harness this capacity almost all the time. If we were to limit every single drug in South Africa to what the FDA says that's what you're allowed to do, our entire governmental public health system would just collapse, because we don't do that. As doctors, as dentists, as healthcare professionals, we get trained to understand the pharmacology of what we're trying to achieve.
Sorry.
Okay. Wait, I'm cutting off. You go.
The full stop of your. One of the things, higher lays. I mean, if it's not approved, it's not FDA approved. The purpose of higher lays is not to dissolve away dermal fillers in an emergency or non-emergency situation. So, and I mean, if we have to adhere strictly to that, then many noses and lips and whatever worldwide would just fall off.
Yeah. That's a prime example. So, I think the FDA does really good work for what they do, and I think we should be aware of what is FDA approved, but we should also be aware of what's CE approved with CE marks, and what is actually registered within our own borders. In our country. And then at the same time, we need to use our medical intellect, to then safely use things in the correct way. Ultimately, you got to ask yourself, are you doing harm, and what is the potential benefit? And this is the balance that we have to play. All of medicine is about gambling to some degree. You got a headache, you take a Panado, 90 times out of 100, this is your percentage of it improving. Okay, I'm just throwing out random numbers, but you get. So when we see patients, we assess them clinically, we take a history, we come up with a diagnosis and a differential, and then, as best as we can, we come up with a treatment plan that hopefully, together with the patient, we agree on as a pathway to trying to get to our agreed upon endpoint. That takes a lot of time, that takes specific choices, that takes you know, a certain level of caring. And I think sometimes, you know, when we see these and I'm going to use this word even though I know it's not right, but Botox parties, because it's a specific type. I mean, it originates from like Tupperware parties, you know, and I'm using the word specifically because I want to show you that I want everyone to know that this is not what we should be doing. We should be treating medicine the way it is, like a medical procedure, where there's consultations. There needs to be a certain level of trust between us as physicians and patients, because there's a certain relationship that needs to happen there. We take more responsibility. If you go to Pick and Pay or Woolies or Spar and you buy a chocolate, they don't ask you, are you diabetic? If you go into a coma because you were diabetic, you take your insulin, you can't go back to Spar and like sue them and say, oh no, you know, that's malpractice. No, relationship is very different. And I know we always get, well, not you and I, we all, the three of us are all in agreement, but we always get this discussion on, like, is it a patient? Is it a client? No,
it's a patient.
It's a patient, because you're a doctor, so act like it.
Yeah, always maintain that relationship, that doctor-patient relationship.
And because you're doctor, you're supposed to act in your patient's best interest.
Absolutely.
Exactly.
Yeah. And another thing I want to say, you know, the difference between a medication and a poison is the dosage. So you need to use you need to know what you're using, and don't abuse any treatment.
Yeah, and look, I know I said earlier on, I was intimating a sort of a negative influence towards naturalism, or this is not true. I mean, like, we get a lot of our medicines from nature, you know, like, you know, aspirin and the bark of the willow tree, or penicillin from, you know, citrus fungus and all sorts of things. So but by no means am I saying that, you know, if you use roots of this or that, that you're not going to get any effect. The only real difference is that in medicine, we measure the milligrams, we isolate the active ingredient or the actual medication. At that point, we can then also now do studies to see how dangerous, how many patients do we need, what is the milligrams per kilogram, how does it actually work? It's the dosage and it's the level of certainty. That's the only real difference. So yeah, so I don't want to make it seem as if I'm saying, hey, don't do anything natural. But at the same time, you know, I get a lot of patients who are like, no, that's not natural. This is natural. I'm like, you know, spiders are natural too. And like, if it's a poisonous spider, that's not fun, you know. So poison ivy is natural, you know.
It doesn't mean that something is natural, but it's always good for you, or it's always safe. You know, you get a lot of dangerous natural things, and like he was saying, it's also about dosage. You know, whether what using is, you know, whether it's natural or not natural. You know, and then, you know, going on, and I know I keep on looking at you guys, and you know, when I'm looking at myself now on the live, I look a certain way, but when it's actually playing, I look different. So, you know, it's moving on to our next thing about social media. Zeenit last year did quite like, you know, you did like quite an extensive sort of lecturing on social media, the effect of the selfie. I know, you know, being really close to someone, you get that feeling of intimacy, but it also distorts the way you look, and, you know, they say it's a driving force now to seeking these sort of treatments. But now we're in a different vibe as well. You know, everyone's doing these Zoom meetings and lives. Everyone looks not like themselves, and, you know, awkward angles, and you just think, is it a thing anymore? Are people like, is that what I really look like? And do you think there's still that drive to get procedures done because of, yeah, like just talk us through this whole vibe of, the effect of social media on us and all of that. Yeah.
I think it plays a big influence in how people see themselves. And from the beginning of time, we've always looked at ourselves, whether it be in mirrors or, in a pool of water or from the Polaroid cameras. We've always been, interested in the way we see ourselves. And I don't think that has changed, but I do think now with the social media, it flips some of the images, the cameras, the fish eye lens of your mobile phone, the distance of the camera. This all influences the way you are seen in the picture. It's a distorted image, basically. And the problem comes in when
people yeah. No, sorry, Z, just say the problem comes in. You're going to say?
When people become they become obsessed with that image or looking their best in that filtered picture of themselves, because it's not a true picture. As I mentioned, there are many factors that influence the way we look in the on social media, and we're always trying to get that perfect image, the perfect selfie. Now, there's nothing wrong with selfies. We all take selfies. People want to take, it's good memories, it enhances your confidence. But then on the negative side, people, as I mentioned, they sometimes lose touch with reality, and they want to look that way in person. And, there was that whole Snapchat dysmorphia. And,
because of the filters.
Because of the filters. So they think they should look that way every day, and they come and present to our clinics asking for us to change them into that distorted image.
Distorted photos.
Possible. Yeah.
Very difficult.
Yeah. So a lot of psychology behind that.
You can't with
I think it's gotta be sort of like a dual kind of dual-edged blade. Like I think it's probably two ways now with everyone being locked down, because on the one hand it's almost acceptable to look scruffy, and even if you look at all the sort of late night shows, like nobody's like dressed to the T because everyone's doing their shows from home,
acceptable.
So on the one hand there's that. On the other, I think the patients who have these tendencies or towards things like body dysmorphic disorders and specific narcissist traits, I think that the focus on having Zoom meetings and Instagram lives and all sorts of things, with more so now because they can't interact with people in real life, I think it
can
be
become dependent on that.
So I think there's aggravating or triggers. At the same time, I also think for the general population as a whole, most people are kind of like, whatever, I'll get a haircut when I can get a haircut again, and I don't know. I think there's, I don't know what the overall balance will be.
No, true. When we out of this, and now, Z was mentioning, and you also mentioned it in your talk, and she actually used Shahien as an example. And now all the time, we should try it. Like, take a selfie and then have someone take a photo of you further away, and you can see the distortion and the difference. And I think this is important now, because now there's been a bit of a, like on one of our groups, there was a bit of a telemedicine, confusion. But now virtual consults are becoming more acceptable because people can't go around, and how to when you're doing a virtual consult, especially when it's something like aesthetics, where to have your camera, and you can't really send a photo selfie. So there are some rules
I
with
think
that.
You're absolutely right. Yeah, if we're gonna have to be able to assess patients remotely, then I do think that it is worthwhile having some guidelines and standard operating procedures that we can actually follow. And I think you're absolutely right. Specifically when it comes to rhinoplasties and for listeners out there and followers who are worried about their nose, when they specifically worry about on selfies, do the exercise like you said. Take a photo nearby, take a photo from further apart. And if if you deem that your nose is not great and your nose is just a lot bigger and it looks different from further away, then
Yes.
know that it's only an illusion, that
Yes.
distortion is created by the actual camera. So this hopefully would relieve some anxiety, because for the people, for the patients out there who have BDD, it is absolutely disabling. They cannot think of anything else.
Yeah.
So I think, you know, for those with less traits towards anxiety, and it's not, sometimes it's difficult to understand what these patients are actually going through. But when we see them from a medical standpoint, you know, we're privileged to see the other side, and I think there's a certain amount of empathy and sympathy that goes, that really shows that it's terrible to have such a psychiatric condition.
Yeah.
So selfies certainly are brilliant business cards and all sorts of things, but I think we also have to be sensitive to the ones who might fall off on the other side.
Yeah. And then again with social media now, we, you know, it's not like we wouldn't have a look at influencers or celebs and what they're doing, but I don't know if anyone really cares now. You know, while you're on lockdown, people are so like in survival mode, or so busy, actually more busy than they were before. I think cooking and making things and doing whatever else. I haven't actually had a look at like you know, say Kim Kardashian's feed, or you know, whoever, Brett, but whoever it is, you know, you're not even looking. I think people are more into TikTok actually now than what the celeb is doing on lockdown. So what is it, you know? And like I was saying to Professor Bobkana the other day, it's become, I don't know about the UK, but you know, here the US, it's become almost like enmeshed in our aesthetic practice, you know, to have like an influencer type to be you know, to come to the practice and, you know, do treatments and such like. Do you think it's a thing? Do you think it's going to be a thing? Do you think people care anymore? Influencers still relevant? What do you guys think?
I think it's changed. A lot of things have changed. A lot of perspectives are changing. So I don't think it'll be as popular as it was, but I mean, you never know. But I think it's a good thing that people are now self-reflecting and looking at things in a different way, and not just focusing on influences. And I mean, I've never liked that to begin with.
This is what we hope people are spending their time with. If you're stuck at home and you are not an essential worker, so you kind of have to just be where you have to be, then we hope that this is an opportunity to then choose to come out on the other side of this as, you know, a better
I don't know what's happening.
Oh, there we are.
Sorry, it just went buffering, that little circle thing. I don't know what happened.
Yeah, I think we got stuck. So basically what I was saying is, let's, you know, collectively and individually choose to take this opportunity. We're probably never going to be told ever again, hey, stay at home for a month. You know, like, when you start, you know, in scholarly days, you get like what, 2 months of holiday and varsity, and then you start working, and then you're like, oh my goodness, I wish I could do that again. This is forced upon you now. So use the time to do things that you couldn't, or you always say, if only I had time. And then by the end of this, you hopefully will come out having achieved something.
You know, even though I do, well, you know, I'm still doing, and you also, Shahien, you know, like a simple work. We still have to go in. I do feel like there's definitely more time, but in a different way. I'm just still trying to catch up with, you know, webinars, and I do feel busy, but it just feels different. And I'm not sure I really want to go back to what it was. I don't know how to go back to what it was actually. And how are we? I don't know. We'll have to navigate the new normal. I know we're going to go through protocol.
I completely agree. At the same time, ironically, you and I think we all feel the same. We feel drowned at the moment by just so many different things, so many webinars, so many trainings, and even though we're not seeing massive amounts of patients, we're not like, doing lots of physical work, there's just a lot of things coming at us at once. And like I feel inundated with the amount of trainings, online things, webinars, Zoom meetings, trying to cover COVID and track the numbers, and in the beginning it was like a little maddening, and then after a few weeks and still working at the same time and being in theatre and the rest, but now I've taken a little bit of a step back, and it allowed me to gain a little bit of perspective. And for medically trained people like us, we have much greater insight into what's happening. And if you were just one of the general public and you have a lower level of sort of medical education, then might not understand what COVID truly means and what the coronavirus and, the amount of mass hysteria that's going around can be a little overwhelming. And what I'm hoping is that people at home are scared to the right amount where they can make informed decisions. Not frenzied and mad, and I'm going to buy all the toilet paper I can find,
Stockpiling.
And at the same time, not blasé. Oh no, it only affects like old people, So we want that balance. And I must say, one thing that I'm quite really happy about is that our president has taken early steps compared to many other countries, and it's brave. It's not easy to make such big decisions that will affect millions of people across the country. And there's a fine balance, and sure, like things could be better. Things could always be better. Things could have been a lot worse. So I think our government has done a commendable job. Everyone really, really should be. I'm proud of the decisions that has been made. I must say, I'm proud. I'm not proud of every single decision that the government has done, and now I'm going to sound like an anti-government, like a. But I must say, like in this regard, it's not just flipping a coin. They've gone to the science and. To the limits that we can do, because it is a novel virus. It is not the flu. It's not just it's a new novel. We don't have a lot of history with this specific virus, so we don't know all that much. We know enough, and we certainly are amongst the world sharing our experiences with medications and treatments and how to treat patients, and also from an epidemiological standpoint, how to try to prevent the spread.
Yes.
And I think, our government really has listened to experts. And this is something that we should be proud of, and I think I celebrate it.
I think most are. I know there's especially when the lockdown was extended. I always say it was a bit less kumbaya, that people did feel a bit down, and then there was a lot of differing opinions. But I also believe it was the best, and it was the best at the time. It's not easy, and it's not easy for anyone, and not easy around the world. It's just a really unusual and uncertain situation, but we have to make it through it. We'll have to make it through it.
We have to deal with what
we have to unfortunately deal with it, because it's the reality. Yeah.
In retrospect, it's easy to say, you know what, we should have done this, or we should have done that. That would have been better.
Yeah.
But with the amount of
when they go, not let anyone from Italy in, but you can't, It's when you shouldn't have let the guy, but you can't, it's very difficult, like you say, to be in charge of millions and millions of lives.
But people must realize also that these steps are taken to protect us. It's not meant to hamper our fun or living. It's meant to protect us. And
Yes.
people sometimes don't realize that. Yeah.
I think, guys, so we did quite a roller coaster type of live. We were talking about
All sorts of things.
There's so much.
Selfies. I know you did have quite a nice message in the previous video that's already playing on IGTV. But any messages you wanna leave us with? Anything from your side in Nelspruit? What do you want to leave us with? With the end of this this lockdown live.
So, I want to say, people need to keep positive, keep healthy, healthy mind and soul. And the world is in the process of healing itself. And we are so blessed to be given this opportunity to heal ourselves and take a step back, take it all in, be grateful, be thankful, be mindful, and then go forth and build yourself to a better future.
Yeah, I think, I'm going to mirror you. I think your words were probably the most pertinent. It's never going to be normal, neither should it. The new normal should be better than the past normal. And if we focus on a goal out there, then we can sort of slowly but surely move towards that. So I think we gotta, picture the way we want the future to be, and then make informed, specific changes to habit, to behavior, to interaction, so that we can create this kind of future that we're looking for.
Yeah, a better future.
Yeah. And I think the future is bright. I think, there's lots of doom and gloom and everyone's going to die and this is going to happen and no one's going to have grandparents anymore. And
the fear. That's one of my fears, actually. Yes, yeah.
Exactly.
I mean, you go, it's like an up and down every day of yes, I'm grateful. Oh, this is scary. But I think that was the first. I think eventually people, go through denial and all of that. Yes. But I think now most people are in an accepting phase, an acceptance phase.
So in that acceptance phase, we can think a little bit more rationally about the things that we're actually doing and how we can then prevent this from either spreading or from reoccurring. Because, by best estimates, most institutions are putting it at that, we're 12, 18 months before we can start getting vaccines. So we're going to go through various cycles or through various seasons. So this is not something that's going to instantly just disappear.
I know, yeah.
And again, sure, that's not great, but it doesn't have to be the worst thing in the world.
No,
it could possibly be the stimulus that we require to actually start making changes. And it's simple little things that the government has been trying to get across, trying to convey. Go wash your hands. Don't hygiene. Shake hands. These are basic hygiene. But can you wash your hands if you don't have water? This is the reality. It's not, for the three of us, it's very easy. We all live in houses and we have facilities, but we have to look at the other side of things.
Other communities. And I work in
practices. And in that way, we almost highlight the things that are lacking in our country, because we want to come out as better individuals, but we want to come out as a better country too. There's a level of patriotism that hopefully will be sort of engendered by this whole thing.
And we've all worked in, and I still currently work in a disadvantaged community, and we've all worked in, conserves, internships, even while you were MOs. And I'm saying, there's a lot of drives out there. There's a lot of NGOs. There's the gift of the givers. So if you can, I know it's really tough for everybody. It's tough for us as well. The first 2 weeks, I think we're scrambling, thinking, okay, how do I save a small business? How do I pay my staff? What is TERS? What is this? I think it was very stressful for everybody. And, but, even if it's a little bit, you can help people in your own little way. It doesn't have to be big or huge or a campaign or a drive. I think,
Yeah.
we have to see where we can help people, whether it's,
Yeah, if
something
you're at the
sanitize,
monetary
food,
means,
whatever.
then
Yes,
donate whatever you
true.
can. But,
Yeah.
even if you can't, then, within your own community, the
Yes, yeah.
elderly, give them a call. If you are
Yes,
going to go
yes.
to the shop, ask
Like,
them, buy you
yes.
the bread or whatever it is you require,
Yeah.
so that they don't have to go out and expose themselves. There's all
True.
sorts of things
Like,
that you can do.
yes, like, so, like,
And again,
physical
I
and
said, like,
emotional support. Yeah.
like Trevor Noah said it on one of his daily shows. During this time,
Mm.
act like you're part of a community, not like you're alone.
Yes.
If you're part of a community, you're not going to just buy all the toilet paper because
Yeah.
you're thinking of
Mm.
other people too. And like the first instinct that we have with something that we don't know, and that's our greatest fear, like humanity's greatest fear is like the
Yeah.
unknown, is to hoard stuff. But if you think I'm part of a community, then you're going to act in a slightly different way. And
Yeah.
hopefully
True.
this is what's going to happen with everyone, so we come out of it again better community.
And go back to the
Yes, I
way
hope
things
so.
were in a community, looking after each
Yeah.
other.
Yeah.
That's a good thing.
Yes.
So the future's bright.
Yes.
Yeah.
And yeah, guys, I cannot wait to see you in person again. I don't know
Aww.
when that'll be. We actually we used to use real, not webinars, we used to use real training sessions as an excuse to see each other. But this,
Yes,
yeah, this
yes,
was
yes.
pretty cool. Yeah. And yes, I think the future is bright. And I think, we'll all adjust. And the important thing is to help others that are not adjusting as well. Help them
Exactly.
adjust. Yeah, help them adjust. But thank you so much for your
Oh, thank you, Ange.
time. Yeah, tell Poppy she's gone somewhere now. So thank you for a cameo role in our live. And then
Thank you.
we'll chat again, guys. We'll chat again. Thank you so much.
Thank
Bye.
you
Thanks for
so
having us.
much.
Thanks, Ange.
Bye.
Bye.
Bye.